Thank you so much for being here today. We are excited to invite back leaders at the Division of Developmental Disabilities. And that team is made up today on our call of Leah Gibbs and Nicolette Fidel. They have been very busy communicating in virtual town halls and on meetings like ours, all of the new guidance for providers, for family members, for others who serve individuals with intellectual and developmental disabilities here in Arizona. And a lot has happened in the past 8 or 9 days regarding updates. So I'm just going to hand things over to you, Leah. We are very eager. This is a very motivated group. I can tell you that. I've been corresponding with them all week. And thank you so much for coming back and sharing the updated information with us. I know that a lot of you have questions, so please raise your hand on the phone. Or of course, as John said, you can communicate that way. So Leah, the floor is yours.
Thank you very much, Sarah. And we appreciate the opportunity to return. My name is Leah Gibbs, and I am the administrator of the Office of Individual and Family Affairs with the Division of Developmental Disabilities. And my colleague who's joined me, Nicolette, would you please?
Hi, good morning, everybody. I'm pleased to be here with you. I'm Nicolette Fidel. I'm one of the Deputy Assistant Directors for the division. I support our network operations, which includes network management and our Office of Licensing, Certification, and Regulation. Again, thanks for inviting us to speak today.
Thank you. What I'd like to do is give you an overview of the actions that the division has been taking, and then Nicolette and I will be more than happy to help with any questions that you may have. The division's top priority continues to be the health and safety of our members, families, and the professionals who support our program. The division is working with the Arizona Department of Health Services and the Centers for Disease Control and Prevention, using their guidelines to ensure appropriate measures are in place to allow for the continuation of necessary services for our members. We are doing ongoing monitoring with our vendors regarding service delivery and availability. We have established a COVID-19 page at our DDD website. A shortcut to that page is it's https://bit.ly//COVID-19 actions. On March the 11th, the division did reach out to all of our qualified vendors to ask that they update their pandemic plans. On the 12th, we established a website that is an email address that our provider community can correspond with us in the event that we've had to make changes to service delivery for an individual member or for a specific site location. On the 16th of March, we initiated conducting our 90-day planning meeting reviews with our support coordinators through a video conferencing or telephone calls. On the 17th of March, the division did suspend all of our in-person on-site monitoring. However, we continue to provide investigations in person anytime there's a serious health and safety threat. In March, from the 17th to the 26th, we started allowing for telehealth for some specific services. And at that time, those services included physical therapy, occupational therapy, speech therapy, early childhood autism services, and habilitation music therapy. On March 25th, the division provided guidance to allow for day treatment services to be provided in the member's home. We also lifted our prior approval requirement that if day treatment is provided on a 1 staff to 1 member basis or a 1 staff to 2 member basis, and have allowed the vendors to bill for those rates. The division has not issued direction for day treatment programs to suspend their services. On March the 29th, the division posted a document that is specific to provide guidance in congregate settings and non-healthcare settings regarding COVID-19. That's been a living document to us, and as new guidance is made available and new direction can be shared, that document is updated. It's been updated on April the 3rd, again the 10th, and on the 14th. And we are going to be doing one more update to that very shortly. The document is posted on our COVID-19 page of our website, and we encourage people to please read it. It's got a lot of valuable information. On April the 14th, the division started initiating specific town hall type events for our qualified vendors who provide group home services and for those who provide developmental home services. We recognize that those are very unique living situations, and they have been experiencing some of their own unique challenges. This has allowed an opportunity for us to provide those vendors with technical assistance, information, and to gather feedback from them. As I'm sure you're all aware, on the 31st of March, Governor Ducey issued his executive order for stay home, stay healthy, stay connected. He also indicated that essential businesses will remain open. The Department of Economic Security has been identified as an agency that provides essential activities, and the Division of Developmental Disabilities, with our qualified vendor network and provider staff, will continue working and services will continue for our members. On April the 2nd, Access allowed for the division to expand the current benefit limitation for the receipt of respite services. Respite has been at a maximum of 600 hours per year, and that has been increased for this benefit year to 720 hours. That will be expiring as of September 30th of 2020. If a member or family is feeling that they need to have a reassessment for their respite hours, we encourage them to contact their support coordinator and they can work through that assessment process. On April the 8th, the division issued information that was allowing parents to temporarily become direct care workers for their child if their child is a minor. There is a guidance document in English and in Spanish posted on our COVID-19 webpage. The document allows for a parent who is over the age of 18 to be a paid direct care worker. That would be parent, step-parent, or legally responsible person for a minor. The support coordinators are and continue to reach out to the members and families that they support in order to evaluate if their service needs changed and to help them make sure that services are continuing. If a family member has not had that contact or their needs have changed, we continue to encourage you to reach out to your support coordinator in order for a reassessment to occur. In order for a parent to be a paid direct care worker, they must meet the qualifications that are required to provide the service. The qualified vendors are also required to follow the existing background check requirements as part of that process. On April the 10th, Access granted permission for telehealth to occur for the services of employment and habilitation. A guidance document for that has been posted to our COVID-19 webpage. Billing for how that service can be billed for qualified vendors is also posted in the frequently asked question guide that is located on the COVID-19 page. Would allow health when it is appropriate based on the outcomes and goals for the member to occur for employment services, to occur in the member's home, and also for day program support. The division has also received approval for the Centers for Medicare and Medicaid Services to the Access Administration to allow for temporarily expanding settings where services may be provided. That guidance would occur in and is posted in our congregate care setting document that is on the COVID-19 webpage. As I mentioned, that document is a living document. There is currently preliminary guidance for the expansion of settings, and that is being updated and will be posted soon. Excuse me. Access has also approved a new service for people who are DDD long-term care eligible, and that is for the temporary provision of home delivered meals. This is not a service that DDD has provided in the past. It will be temporary through the COVID-19 emergency. The division is still finalizing the guidance information on how this service will be implemented. Some of the things that we do know today is that this service is available to the DDD long-term care member only, and it is currently limited to 1 meal per day. The division does continue with our support coordinators to assist families who may need food boxes to make sure they're made available. We ask that you watch the frequently asked question guide on our COVID-19 page for additional information as we implement this service. I don't have an exact date yet as to when that guidance will post, but I expect it will be early next week. Some of the provisions that we have allowed in supporting making sure members receive services have to do with training requirements. One of the training requirement changes we have implemented is that prevention and support training has been temporarily adjusted regarding who is required to receive it. If a qualified vendor hires a new employee and they are working with a member who does have a behavior treatment plan with functional behavioral assessment, or who is receiving behavioral health treatment for a challenging behavior and may require physical intervention, prevention and support needs to be trained. If you're working with a member that does not meet that criteria, prevention and support has been temporarily suspended. The division has posted on our COVID-19 webpage a list of individuals and agencies who are available to provide that training if it's required. We have also allowed for a 90-day extension period for any employee whose current prevention and support training certification has expired or will expire soon. For our training requirement for Article 9, the division has authorized that to be provided through a webinar style training with a live instructor. For the services first aid and CPR, the division is allowing for a nationally recognized provider to provide that service online. An employee may take that service online, and we will accept that at this time. However, once the COVID-19 emergency is over, we will require that individual to do the in-person evaluation to demonstrate that they do have the skills to provide the service. For the service requirement of direct care worker training, the division has suspended the requirement for 90 days for any new employee who would be providing attendant care services and traditionally require direct care worker training. However, training has been made available through a webinar style training. And if an employee does take that training during the COVID-19 period, that will be accepted. However, at the end of the COVID-19 emergency, that employee will need to demonstrate that they do have the skills and have learned what the direct care worker requirements are. I recognize that's a lot of information in a very brief period of time, and Nicolette and I would like very much to answer any questions you may have.
Hi, everyone. So the chat has been activated. So the one way that people could ask questions is by posting them in the chat if you're on your computer. If you post in the chat, someone from our team will read the question out loud. Another way, if you're interested in sharing, would be verbally. So to do that, you're going to have to raise your hand. I'm going to post a link for instructions in the chat on how to do that from your computer. But the verbal instructions of that are to click the participants button at the bottom of the meeting. And then when the participants panel shows up on the bottom of the participants, there should be a little raise hand button with a hand. You're going to click that. And then if you raise your hand, you'll be called on, and then we will unmute you. If you're on your phone and you wish to raise your hand, push *9, *9. It's important to recognize that once you're unmuted and you're going to be sharing or asking questions, if you remute yourself, you're not going to be able to unmute it again without raising your hand again.
So we have a question in the chat from Brandy Kitzberger. Can you explain how a vendor can access telehealth for employment services?
Sure, Brandy. Good morning. It's Nicolette Fidel. I can take that question. The planning team should be evaluating the members' needs and the outcomes that they have identified for employment and determining whether whether telehealth as a service delivery option is appropriate for that person. If so, the vendor would use either a telephonic or a video platform and arrange to deliver that service via telehealth with the member. We have billing guidance, as Leah mentioned, in the FAQ that identifies the service and then how to bill the modifier that says how you deliver that service, whether it was through a video methodology or through a telephone.
Hi, we have a hand raised from Kathy and Daniel, I think, together. I'm going to unmute you and lower your hand now, Kathy.
Okay.
You are live now, Kathy.
Okay. Hi, my name is Kathy Sweeney. Daniel, I'm a parent. And my daughter usually lives in her own apartment, an IDLA, individualized living arrangement. And I'm actually asking a question for her roommate's family. They're not real connected, but her roommate, who is Arizona long-term care, is still in the apartment. And this family is starting to get a little nervous, actually a little more than nervous, a lot nervous, but there are 8 staff that come in and out of the apartment for their daughter. And so I guess one of my questions would be, has DDD thought about relaxing the rules for overtime, to let staff have overtime? This family has said they would be happy with, 4 staff, because it cuts their daughter's risk in half, or 2 staff to work 12 hours each, if that's possible. So I just wondered if this has been considered at all.
Sure, Kathy, this is Nicolette. I can take that question. So the division doesn't set overtime standards for the vendors. That is actually guided by the Department of Labor. But I will tell you what we have done and are trying to do to support all lines of business that support our members. We've undertaken a series of surveys to get information from providers about things that they're challenged with, things that are costing them extra, including overtime. And we did submit a survey that included home and community-based services, including individually designed living. When vendors respond to that survey, we then make a value-based payment to them. It's an amount of money that's based on a review of the claims that they've submitted over a 6-month period, kind of an average, to help supplement extra costs. So, so there is some infrastructure in funding, and I would encourage, and we would allow, a flexibility for however they decide to schedule those hours. If the intent is to mitigate, more people coming into the home per apartment, that makes perfect sense as a strategy. And so I would encourage the team to get together with the vendor and talk through that as a possibility.
We have a few questions in the chat. I'm going to take them in the order they were posted. So the first one from Karina, just want to confirm what was said. The DCW training for new DCWs has been suspended until after this COVID emergency. However, they can still do a webinar style training and then after COVID demonstrate skills and testing. Is this correct?
That is correct.
Great. The next question is for DCW workers, the 90-day requirement will begin once the COVID-19 crisis is over?
The requirement will be reinstated. That is the plan at this time.
Cynthia asks, there does not appear to be any information about COVID-19 testing for members or direct care staff that are ill. Can you provide information about testing?
So the testing strategies are no different for members or staff of the division than they are anybody else who's in the state of Arizona. There are identified testing sites, and your primary care provider or main care provider really are the points of access for testing for COVID-19. There is information on the website, the Arizona Department of Health Services website, around testing. So I would encourage anybody who's concerned about that to review the guidance that's there.
Okay, from Mary Ann, as employees are working from home and doing emails as representative of an agencies to families, are there firewalls or extra implementations employees should use?
We should, yes, as qualified vendors should already have systems that would provide for sending secure email communication if they're transmitting anything that's protected by HIPAA. DES, DDD employees have methods and are required to use secure email communication anytime they're communicating HIPAA protected information.
So I'm going to keep going in the chat. If anyone raises their hands, I'll start to cut you in, but keep going with the chat. Good morning, this is from Rose. As you might be aware, the special needs population employment may include GSE that don't earn minimum wage. For instance, my daughter earns per piecework. She makes approximately 100 per week. Now, because of social distancing, she does not have a job. However, she was turned down for unemployment for the reason that she didn't make enough money doing her job in GSE. Is this fair to the special needs population?
Hi, Rose. Thank you for the question. I'm very sympathetic to your daughter's situation. The unemployment would be making the, the requirements for who is eligible. So that's not something that the division would be able to influence. Certainly after this emergency is over, your team might want to convene and determine whether or not there might be other employment opportunities that would pay a market rate for her work.
Gail asks, hello, Have we, quote, provided educational resources explaining COVID-19 to those who need them? There are some direct instruction and visual models available to help allay fears and explain what it is all about with regards to the virus.
Gail, thank you very much. This is Leah. The Division of Developmental Disabilities on our COVID-19 webpage has listed several different resources, including resources that are designed for our members to share information regarding the COVID-19 in a way that they would best be able to understand. There are also resources available that if a member is getting anxious or having a difficult time given all the stay-at-home orders and changes in routine, that includes some guidance and available resources through the peer and family support networks to get immediate assistance for that member. Yes, we believe that we have posted several different resources. In addition, there is the covid19.gov page, the coronavirus page, as well as the Department of Health and the Centers for Disease Control and Prevention.
Thank you. Christopher asks, good morning and thank you for this info. My question is why not suspend prevention and support training during this COVID-19 pandemic as other states have done? It seems dangerous to make new hires partake in such an up-close and physical training. The risk of infection is extremely high and the risk of the domino effect if it is passed on to the person being supported is scary. Could webinar training of the didactic and scheduling physical therapy training in 90 days be an option? Especially since the didactic portion is the most important part of prevention and support because it focuses on prevention of challenging behavior.
Thank you. We appreciate that feedback, and certainly we have been trying to evaluate each decision that we make to mitigate risk. So there are some decisions that we've had to make that we've changed over time, and this we can review that decision, each of those decisions. However, in this case, we felt that the risk to somebody who might have challenging behaviors, to have someone working with them that wasn't able to respond to those behaviors in a way that was supportive, was a greater risk than the potential contact with or spread of COVID-19. The prevention and support classes that are offered are set up for social distancing with reduced participants. So the instructors are taking every precaution they can to deliver that training in a way that mitigates spread.
Thank you. Gail, thanks you for your response to her question and wants to share your page with your community. Kin asks, good morning. I understand we need to do DD reports from June. Are we able to just continue with paper submissions? It's difficult to navigate, and with what's going on, it would be easier for me to do paper submissions. Please advise.
So thanks, Kim, for your question. We are, DD reports is a specific software methodology, so that's not the division's reporting structure. However, I do understand that many qualified vendors use that system. We are not changing our methods for delivering progress reports. We still require that habilitative services are delivered to teach, and that there's reporting that's made on progress or regression of members who receive those services throughout the COVID-19 emergency. So that's not one of the flexibilities that we will be offering.
So just as a reminder to folks who maybe are just tuning in or just getting focused here, you can ask questions in the chat feature if you're on a computer. If you want to verbally ask a question or share a comment, you can raise your hand. To do this on a phone, you're going to push *9, *9. You will be unmuted and called on. To do this on a computer, you're going to click participants, and then on the bottom of the participant panel, there's a small hand that says raise hand, and you'll be called on and unmuted. Okay, I'm going to go back to Kathy. Unmuting you now.
Hi again. Is there protocol in place for when a member gets COVID-19 So let's say my daughter's roommate who has 8 staff in and out daily, are the rest of the staff quarantined, or I know the other parents that couldn't be a part of this are curious.
Sure, great question. So every qualified vendor is required to have a pandemic plan and procedures associated with a pandemic plan. And they have come up with, different vendors have various methods really to address either folks who are presumed or under the, it's now called under, formerly presumed positive, now persons under investigation for possible COVID-19. And so I would really specifically for your situation ask you to go back to your qualified vendor agency and have those discussions. However, there is information posted in our congregate care guidance document that gives instruction on ways in which that situation could be supported. So, you know, what kinds of personal protective equipment, how to sanitize and ensure cleaning, how to make sure laundry is done, and provides guidance to the qualified vendor. So that's a terrific resource that was compiled by DDD, but from multiple resources. So I would absolutely ask that team to go back and talk about if this were to happen, how are we specifically going to address it?
Thank you. Going back to the chat, Marilu, my son has a situation that he is in rehab after surgery. We have had trouble with HIPAA rules and getting information between his surgeon and the rehab. This has also caused a problem in him getting discharged from the rehab. Also, with quarantine in place, it is hard to get information from staff. I have medical power of attorney and have had a hard time making sure my son is doing well. We are lucky that we can keep in touch because he can use his cell phone, but it is frustrating with all the rules in place. Do you have any recommendations?
So I think it is a challenging time. It's challenging because we want to be near our loved ones when they're ill, but also understanding that one of the main mitigation strategies, and even ones that we've recommended for our group homes and developmental homes and other residential settings, is really limiting visitors. So I would continue to work through the rehab center where he's currently receiving care and trying to continue to reach out and use the methods that are available. But we do understand it's a very challenging time, both for those who are providing care and those who are trying to get more information about the person we care about.
Okay, I'm gonna go to the chat. I'm gonna unmute Debbie. I'm gonna go to people on computers. I'm gonna unmute Debbie, and then I'm gonna go back to the chat. So Debbie, I'm unmuting you now.
Hi, this is Debbie. I have a question regarding group home settings. So is there a requirement by DDD that the vendors or providers must notify parents and legal guardians if a staff who had been working at the group home has symptoms that is out sick, has symptoms of the virus, maybe not got tested yet because of lack of testing, or at a minimum, must they notify parents and legal guardians if someone that staff that worked at the home test positive for COVID-19?
So anyone who tests positive for COVID-19 is receiving support from usually the county health departments, and they will be providing guidance around contacts and who would need to be notified. Additionally, Debbie, we have a requirement of our qualified vendors that if they identify someone who is a staff member or a member who has been has COVID-19, we have an incident reporting process. Our quality management and healthcare services team then work to identify anybody that would have had contact with that member to begin notifying and making sure that there's mitigation strategies. So if you're legally responsible for someone and there is a positive member, well, a positive staff member was your question, then you would be notified of that. And we would expect the vendors to take action to mitigate that risk.
Is there a time limit, or what's the time frame to notification?
You know, I don't know what the health departments what they're saying. We have a 24 right away, but no more than 24-hour notification for incident reporting. We did just post that guidance for qualified vendors on our website the day before yesterday.
So the vendor would be required to notify.
Yes, I mean, as soon as possible, but not later than 24 hours.
Okay, but not if they are out sick with symptoms. You know, maybe they haven't
No,
been tested.
because we don't, they could have the flu, they could have seasonal allergies. We would ask, or we have instructed vendors who provide services that if anybody appears ill, that they be sent home. So, you know, that's why we're asking vendors to screen for fever, either with taking actual temperatures or through self-report if temperature is not available. But it is with the expectation that we're all monitoring this very closely and that immediate action is taken when any potential illness is identified.
Okay, I'm going to go back to the chat. So Brandy asks, has there been discussion on delivery of services and rates for remote employment services changing? If so, what are the changes?
Great question. If you look on the Access website around telehealth services, they've provided guidance to all the managed care organizations that they contract with that the managed care organizations cannot change the rates to be lower, for example, to deliver telehealth services. So DDD has maintained its current rate book for all of the services that it provides, and basically the change that we've made is to add modifiers in our system so that we can identify how that service was identified or was delivered. Was it through a video methodology or through a telephonic methodology? Other than that, our rates are the same.
All right. Looks like Sarah also shared, there's been a couple shares of the link to the DDD page and some appreciation for people sharing that link in the chat. So thank you. I think, I don't see any other unanswered questions in the chat. So feel free to ask questions in the chat or raise your hand.
Brandy had a follow-up to her question.
Go for it, Jeff.
Will remote teaching of employment services be continued after this?
We've been getting this question a lot. I think it's a very valid question. All of the flexibilities in telehealth are posted on the Access website, and there's sort of two buckets, if you will. There's a set of codes that are were already approved to be delivered via telehealth, and that primarily for DDD includes our therapy services, occupational therapy, speech therapy, and physical therapy. There's a set of other codes that are only being approved for the COVID-19 pandemic. And those are temporary, and we don't anticipate that those will continue to be allowable for delivery and billing after the emergency. That being said, I think nationally there's a lot of learning going on, and it might be that that these times are informative to our system particularly, and that we can use some of this information to get creative about how services are delivered in the future. But immediately after the emergency, we don't anticipate that employment or habilitative services will be delivered via telehealth.
Okay, I don't see any questions in the chat. Kathy has her hand up again, so I'm going to go to you again.
This is another question from the parents of my daughter's roommate who is still living in their apartment. What is the protocol if a member in an IDLA gets the virus? They're pretty terrified they cannot bring her home. And I guess it's two parts to that question. Is there hazard pay that's been talked about?
That's a great question. Yes, we're not calling it hazard pay, but yes. So we certainly understand the importance, especially of people who live in their own apartments or homes, that they are going to need support and care should they become ill. The procedure that I referenced earlier about reporting COVID-19 positive cases actually does include that in some cases, our healthcare services team will be identifying vendors that we would approve negotiated rates to help them pay for staff who, you know, are taking a risk in providing care to somebody who's COVID-19 positive. And we want to be able to give them all the flexibility we can in maintaining staff and hiring staff. We've had some vendors who have some very interesting and creative strategies too. Some things that have shared with us in cases where they've had concerns about exposure and they need to quarantine, not isolate, but quarantine. They're offering staff to actually, in some cases, quarantine together because with somebody that they've already worked with, so that the staff's not going home and potentially exposing their own family. And so that some of our vendors have offered some real flexible ways to do this. So the answer to that is yes, there can be rates identified when necessary to secure staffing.
Okay, going back to the chat, Kira comments, there is currently no one-to-one rate for TTE. How will TTE be billed?
We are aware of that. That's actually one of the items that our finance team is working on, and we will provide additional guidance as soon as that is remediated.
Okay, sticking with the chat, Brandy's wondering if anyone has the link to the access allowed codes for telehealth. I don't have that ability to look it up right now, and I know that our team will promise to put that on our website, but I don't know if anyone's able to share during the meeting.
I can put it in, it's Nicolette, and I'll put it in the chat.
Thanks, Nicolette.
Mm-hmm.
Okay, we have a couple of comments. Christopher, who asked a question about prevention and support, shared a further comment. With all due respect to the answer about prevention and support, I am really struggling with the concept of someone with challenging conduct acting out being a greater risk than someone being infected with COVID-19 and possibly dying. It would seem that mandating courses like positive behavior support, along with prevention and support didactics, would further strengthen the DSP's ability to prevent outbursts. Then strategically placing those staff who have had or currently have prevention and support training with those supported, maybe more likely to engage in that contact, would make more sense than putting people at risk, again, as a temporary solution. And then I think this is a similar question. Margarita says, I got a bit concerned about not being possible to do habilitation online. Am I correct?
So thank you to Christopher. I absolutely understand what you're saying. And as I said, we are certainly reevaluating our decisions as this unfolds, and we will definitely take your feedback around that issue. Margarita, regarding your question, so habilitation, service delivery via telehealth for employment and habilitation guidance is posted to the DDD website, so it is allowable, but that's based on the ISP team evaluating the outcomes that the member has and determining whether the service delivery of sort of a video or phone methodology, both of those factors, whether those the member will benefit from a telehealth type service delivery. If the outcome is appropriate to telehealth and the service delivery model will work for the member, then and the ISP team agrees, then that can be delivered through telehealth services.
Nicolette also posted that access link to the chat if anyone's looking for it. So thank you. Margarita, thanks you for your response. Any other questions out there from Zoom world in the chat, or unmuting on or raising your hand on your phone with *9, raising your hand in the Zoom chat by clicking participants and then the raise hand function. All right, we have a question from Beverly. Are RSA and employment services still going on?
Could you possibly unmute Margaret Corcoran from DDD to provide some guidance? I have not been in RSA's meeting, or if there's anyone from RSA on this call, if you could raise your hand to give an update on how services are being delivered.
Margaret Corcoran's been unmuted.
Good morning. I can speak for the DDD services. There is a provider who is providing them through the telehealth, And there are some members who are participating. The provider has worked at it. It's been a bit of a challenge, but the members each week are learning, they're gaining more skills. So it is working out thus far. We are going to be discussing it with more providers to see what sorts of supports they need, what sort of questions they have, so that we can help them better, develop the provision of services so that there will be greater availability. I am not sure what RSA is doing at this point. Is there anyone on from RSA who can address that?
If folks
Thank
are
you,
able to
Margaret.
raise their hand, I could unmute you if you're from RSA.
And I believe there are other regular employment services going on, not all the providers. There are some members who are still going into center-based employment, some members who are still going into group-supported employment. So there are some regular DDD employment services that are continuing.
Right, Margaret, thank you. That's a really good clarification. We really provided these as flexibilities. It doesn't, if someone has their own job and still needs support, and there are some things that have to be done in person, there are going to be arrangements that we make to deliver supportive services. But it sounds like there isn't someone on from RSA, so perhaps that could be, I think they're going to be maybe communicating with this group in the future. You can ask that question.
Someone from RSA did share in the chat that they're awaiting some further trainings that are on hold. So new information is currently in progress. So maybe, I don't know, we can loop back to this if people do join and want to share information. Going back to the questions on the chat, Kira asks, we have some questions about TTE. Kira asks, can we provide in-home TTE similar to in-home DTA services?
Yeah, so for everyone on the phone, TTE stands for Transition to Employment, and that is a pre-vocational service that uses a curriculum-based teaching methodology to teach sort of employment readiness skills. That can be delivered in-home. It can be delivered via telehealth if appropriate.
Okay, moving on to the next question. Kim asks, for parents providing care, are we only approved for 90 days? She indicates that she was told this by her support coordinator.
So we access through CMS approved payment of parents of minor children, and we have posted that that's through the end of the COVID emergency. As with all these flexibilities that are in place, there'll be sort of I'm calling it an unwinding. So we'll begin with our access partners and other community partners who deliver services in the Medicaid system to identify when sort of the COVID emergency guidance expires and when everyone needs to return to our regular standards. So we'll make sure as we get closer to that we're communicating clearly when those limits or those flexibilities end.
So this is, I think, a similar question on those flexibilities, but about TTE now. Brandy comments, we are currently planning for remote teaching for our summer TTE program. If there is a lift in the coronavirus during the summer, will the vendor need to change to in-person classes?
So we have the habilitation and the employment services are part of that temporary code set approved by Access for delivery during COVID-19. So depending on when Access determines that code set will expire, possibly. However, I will let you know that in our collaboration with them, everybody's very cognizant of the changes and flexibilities, and that we want to make sure people get the services that they need and don't cause unnecessary barriers. And so we'll be doing that thoughtfully and trying to communicate very clearly when those service delivery methods need to change.
So Vicky asked a question, is there an age limit? I believe she means an age limit for the child to be a temporary DCW, or a better question is, can parents be only habilitation and attendance care paid workers for minor children, or what the age range is? And how will nursing services be continued for medically fragile children?
Great questions. And we will put a link to the guidance document that's on the webpage in the chat. The provider of service, so the parent has to be at least 18. And what this change did was remove the prohibition of parents providing care to minor children. So now during the COVID emergency, temporarily, if the member has been assessed for the services and there are no other options, or the family feels that the best option is to be paid to provide that care to limit the spread, and that parent meets the qualifications to be a direct care worker and is hired by an agency, then they can provide services at home for their child. Nursing services continue to be required to be provided by a licensed professional under one of the qualified vendor agencies. So hopefully, Vicki, that answers your question.
All right, Renee asked a question about PPE. She's been asking many who've been trying to get PPE items, personal protective equipment, and cleaning supplies. They've been told there's nothing they can do to assist group homes in getting these supplies. Has anyone reached out to the governor? These are at-risk situations that Renee is concerned about. Sarah responded from ADDPC below, commenting that one city is using their fire department to assess needs of local group homes in city limits, but this is just getting started. And Sarah's eager to hear other ideas about PPE. We've reached out to APAD to see if they have a network, but we haven't heard back. So I guess to the DDD folks on the call, do you have any response to the kind of PPE question and conversation?
Sure, it's being asked frequently, and we very much understand the concerns and share it. PPE, a lack of PPE is a national issue. We continue to work with the county health departments and Department of Health Services on that. We have also, through our surveying of vendors, provided funding to provide more money to purchase sanitation and cleaning supplies, and when available, PPE. We've provided guidance that we've received from the CDC about other ways to protect yourself using face coverings. Even there's some information in the congregate care guidance about reusing and being able to reuse PPE. There's also some guidance on the CDC website. So we continue to communicate. APAD continues to communicate. We've actually had families who've also expressed their concerns directly, both to us and to our representatives, and we continue to work together to try to address that. Most of the PPE identified through DHS and the county health departments, as you can imagine, is being directed to hospitals and other places where critical care is being provided to COVID-19 positive individuals and those who take care of them. So we will continue to work on that issue and are happy to hear any recommendations or suggestions, and have been sharing resources when we hear of them.
Thank you. We have a question. It's kind of VR related, so I don't know if the DDD folks will be able to help. But Margarita says, my son is being provided pre-ETS, but it took a very long time from Voc Rehab to approve the pre-ETS. My son's birthday is May 10th, and Voc Rehab is not allowing more time, even with this pandemic readjustment. Do you have any suggestions?
I would ask if the person who from RSA, if there's anybody that could provide some guidance. I can speak to DDD. We always have a complaint process that goes through our customer service center, and RSA has a process to accept concerns and complaints, but I would need them to outline what that was.
I'll keep my eye peeled if anyone from RSA adds in the chat. Nanette asks, does a parent becoming a DCW for minors also include children with EPD, AL, TCS?
Great question. I haven't checked any of the health plans to see if they implemented that. The information published on Access's webpage on their flexibilities doesn't specifically say DDD. So I would assume that that would be a flexibility available to the EPD program, but whether or not they've implemented, I don't have that information.
Shania asks if summer camps have been canceled.
Great question. So we provide a service called Day Treatment Summer. It's a habilitative service, and we've been getting a lot of questions about it because these typically take place in a center like our other day treatment services. And we have, everybody has some concerns about service being delivered in a center just because of the social distancing. We're about to post a guidance in our FAQs on our website that we will continue to offer day treatment this summer, that we will be asking qualified vendors to consider virtual or in-home, member home or in developmental home options to deliver the service. However, if they choose to identify a service site, that must be inspected by our offices of licensing, certification, and regulation. And they will, just like all of our other day programs that continue to operate, need to ensure that they are following their pandemic plan, have risk mitigation strategies, increased sanitation, social distancing, and all of the other best practices to make sure we reduce the spread of COVID-19.
So Shania, who asked that question, just also added that the city of Mesa has canceled their camps. Let's see. Brandy asks, can a member receive habilitation during TTE remote classes to support the online curriculum? Or is there another way to offer support? And then actually, before you answer that, I just want to jump in really quick to the Margarita who asked the question about VR. Beverly from RSA says that she is, open to hearing the exact concern and situation and invites you to give her a call. She posted her phone number in the chat. So if you need help connecting with Beverly, Margarita, please let us know. So sorry to ask the question and then answer one, but to restate the question that was asked, can a member receive HAB during TTE remote classes to support the online curriculum, or is there another way to offer support?
So one of the considerations in the habilitation guideline would be if there's someone else, if somebody requires physical or environmental support to benefit from a virtual service delivery system, then the ISP team really needs to look at who is available in the home to deliver that. We would not be funding a habilitative service, which is a teaching service, and TTE at the same time, because TTE is also a habilitative service. So I would ask that team who has that particular issue to get together and look at what kinds of support could be provided remotely, and is there any support at home that could help access an online curriculum.
So John Myers from the ARC of Arizona posted in the chat about an upcoming opportunity between ADDPC and the ARC of Arizona for small grant opportunities for providers statewide. This is between $500 and $2,500. Any organization contracted with the state of Arizona and approved to provide supports or services to individuals with IDD is eligible to apply. Next week, the application materials will be out, and you can reach out to John Myers at the ARC of Arizona for questions in the meantime, or you can, he provided a link where you'll get automatically notified when the application materials are out. Thank you, John. Michelle asks, she says, good morning and thanks for all the answers and comments. We are a group home provider and we have not received any extra funds to cover the extra expenses for sanitizing. Did we miss something, or has this allotment been dispersed yet? Been distributed yet? Question mark.
Hi, Michelle. Thank you for your question. So for providers who provide group home services and answered our survey, our group home survey, we are actually in the process of processing those disbursements. So if you did answer the survey, those are in process. If you have not yet answered the survey, it's open. We haven't closed the survey. We want as many providers to respond to it as possible. So please go back to the survey and answer that if you haven't already.
And was the survey sent directly to providers, or is that available on your website too?
It was sent directly to providers through our vendor communication.
Gail is giving John some love in the chat. Think about the resource for these, some money opportunities next week. Thanks, Gail. As a reminder, to post questions in the chat or raise your hand using the raised hand function on the participants tab on your computer, or dial *9 if you're joining by phone. Marianne asks, can you provide that information on the resources for extra expenses for sanitizing? So I think DDD said that information was sent directly to providers. If folks didn't receive that, who could they reach out to?
If they didn't receive that, they can reach out to the customer service center. And that will triage to our provider relations team. We'll make sure they get a copy of that survey. And just Marianne, to be clear, what the department is doing is providing surveys or asking vendors to complete surveys so we understand kind of what their challenges, risks, and costs are. And then based on that survey response, we're providing kind of a lump sum payment. So that payment is intended to help offset things like overtime, extra equipment and supplies relative to COVID-19 mitigation.
And Michelle, who asked that original question, indicates she did receive the survey and she did fill it out. So thank you for your response.
Great.
So I think Marianne is asking about that same question. If you're not a DDD vendor, but you are a vendor for RSA, can you fill out the survey? Are these available?
The surveys are for DDD qualified vendors as a way to transmit Medicaid funds. RSA would have to speak to any funding they would have available to their providers.
Okay, one more question in the chat from Kira. During this pandemic, we have seen a decrease rather than the expected increase of vendor calls in District North. We have trained providers to be ready to help out families in this area. Is there a reason that you think they're seeing a decrease?
Thank you so much, Kira. We really appreciate your agency being ready to answer the call, and we appreciate the work you do. We have been monitoring through our surveys to providers, and we are seeing in some cases families who are concerned about having additional people providing care in their home and have made decisions not to receive services that are on their service plan. That's part of why we really are looking at trying to use telehealth to try to deliver the services where possible. So that may be an option for your agency depending on the services that you provide.
Thank you. I'm going to go back to Kathy. Kathy, you're our most prolific in-person questioner. Okay, I'm unmuting you now.
Sorry, I'm trying to give people time. And
no, it's great. It's great.
Nicolette and Leah, thank you for being part of today's conversation. This is a question from me, and I just really hope when DDD is considering, like, is it, 3 months from now or 2 months or however long that our kids, our adults go back to their living arrangements. And believe me, my daughter was ready to go back yesterday. She says, I'm an adult, a young woman, I need to get back to my life. But I guess to take into consideration those of us who have pretty medically fragile kids that we are taking care of. We were on the phone with her pulmonologist for an appointment yesterday, and he said he said she could be with us for a long time until he feels comfortable. She's on a pump that is basically keeping her alive. And so he said his comfort level for Kelly is he just said, be ready. And he talked with Kelly, had a good chat with her, and she adores him. She calls him the boss. So that's very nice that she listens to him, but he said it could be a very long time that he feels comfortable with her getting back out. We're totally isolated right now as it is, to keep her healthy and safe.
We appreciate that. I think totally understand what you're saying. It's sort of an uncertain time for all of us about what the real timeline is going to be. So I think we certainly will keep that forefront in our mind, and to the extent we can be flexible with sort of unwinding, we will do that.
So Robin shares that they're also concerned about the decrease in vendor calls. So they appreciated your answer about that. And then Beverly, responding to some earlier comments about RSA, says that her understanding is that vendors for RSA are responsible to determine how they want to conduct their services. Shauna asks, any news about how soon Access will require in-person meetings to be held by support coordinators, as the state may reopen soon and people are hesitant about entering into others' homes?
Not yet. I think that will be one of many flexibilities that we'll need to communicate carefully, but we don't have any indication yet that that's imminent.
So there's some people sharing some PPE stories about communities coming together and making masks, which I can personally say are some of the more inspiring stories that I've been hearing lately. So Jamie shares that a forward from a community engagement liaison to the mom who states her daughter is missing out on unemployment due to making $100 a week. The answer from Jamie that was forwarded says they can appeal the denial through the regular channels. The Department of Labor has not changed the amount of income that must be earned to qualify for benefits, and they've posted a DES page where wage requirements are continuing to be updated. They also suggest the client go through the appeal process first, and maybe during the process, if the rules are changed, it could apply kind of during it. So I think that's, thank you so much for sharing those things, Jamie. Okay, I think we're gonna do the last call here. Post any last questions in the chat or raise your hand with *9 on your phone or click unmute on the participants tab. As we give people a chance for a last chance, okay, one last question here. Kim asks, just want to confirm that income we receive taking care of our kids are not taxable. Do we have to claim taxes on that?
So I think that he's referring to parents who become direct care workers. If you become an employee of an agency, then the requirements of being taxable would apply. You're an employee and you would follow the same requirements as any other employee of that agency.
Vicky clarifies how young can the child be? I think
So
she means, yeah.
There's no, the age of the child doesn't sort of drive whether the parent can be a provider or not. The age of the child, though, should factor into the team's assessment of what services are needed and what outcomes might be worked on.
All right. Yeah, someone clarified that you must pay taxes on that income. Certainly not an accountant. Oh, we have a hand raised from Debbie. Debbie, I'm going to unmute you and go back to you again. Debbie, you are now unmuted. No, not yet. Okay, Debbie, you're live.
Hi, yeah, this is Debbie. I have a comment on a previous question and then a question. Regarding the qualification eligibility factors for unemployment, I finally got through to unemployment this week. Both of them, I also am in the same boat of we calculated the orders that we use. And basically what I was told was, yeah, you don't qualify now, but we're still figuring out, you know, the COVID-19, the CARE Act, how it affects or may affect you, and that may change. So what I was instructed to do was keep filing the weekly claim. So you make the claim, and then you're denied, but you keep filing the weekly claim because it may change, just as Jamie was stating. And then my question is to yesterday, and then a little bit of a discussion. I didn't.
I'm having some trouble hearing you, Debbie. Can you try restating just your question and go a little slower? It's kind of, I think it's the tech is breaking up.
Sure.
Debbie, you might need to put your question in the chat, and we'll get to it in sequence.
Yeah. Okay.
Thank you.
So a question from the chat is about stimulus checks. Do you have any information on if our members will receive stimulus checks?
This came up last night, I believe. John Myers responded to that if you're an SSI recipient, you should be able to expect a stimulus check. And then some folks who are employed who have filed taxes potentially could expect stimulus checks. When you will get your stimulus checks, I cannot provide information about that.
And I will comment personally, I know that if for any reason, like these stimulus checks are in relation to taxes you filed in previous years. So I encourage you to visit the IRS website if for any reason you have not filed taxes in the last couple of years. There's many reasons why people may not have filed taxes, and there's a few options for things you can do if you're in those situations on the IRS website. And then similar, I'm going to go to John Myers, I think, who is probably going to say something similar to what he said last night. John, I don't see audio connected for you. Are you connecting via a phone number? If so, can you chat me the last 4 digits of your phone number so I can unmute you? There's also some comments in the chat talking about this question of taxation, which is, maybe not the most interesting question. Kin comments, there's an IRS notice to consider. Some people are talking about taxes. So I would encourage you to go to irs.gov and or talk to a tax accountant. Okay, I got John's number. Okay, John, I think you're unmuted.
Okay. As of Wednesday of this week, the U.S. Treasury Department announced that people who receive SSI and do not have dependent children will automatically receive those recovery rebate checks. They'll be automatically deposited. They do not have to be tax filers, as many people who are on SSI are not tax filers. But the government will use their existing records for SSI payments to make the recovery rebate payments. If they do have dependent children, there is an additional form they need to fill out, and they can go to the treasury.gov website and do a little navigation and find the information they need. Right now, there's still an issue with people who receive VA benefits, VA disability benefits, but as far as people who receive SSI goes, there's nothing more they need to do. They should get those payments automatically.
Thanks, John. All right, I think we're gonna switch it over to go back to Sarah Roof. Sarah, are you able to talk?
Yes, hopefully people can hear me and see me. Had to switch devices.
We can.
Great. I just wanted to piggyback off of the announcement John Myers put in the chat box earlier. That is going to be the small grant opportunity. We're hoping to roll that out sometime next week. We don't have a hard date, but we're very excited to be able to provide some small amount of funding for providers who would like to reduce social isolation. We want to promote individuals with intellectual and developmental disabilities staying active during this time. We know that there's going to be a lot of activity at the end of the month. Some things may open back up, but we are dedicated to doing a reimbursement style grant and a very, very, very quick turnaround for that reimbursement. So this is a little bit different. If you are familiar with funding from the Planning Council in the past, this is going to be anywhere from $500 to $2,500 that you can apply for a reimbursement grant. And so we're really excited to be able to provide that opportunity. If you want to sign up for our notification so you know immediately when that opens up, please scroll back through your chat box.
John just reposted it just now.
Awesome. Thanks, John. I know you posted that earlier. You'll be able to sign up for our email list, and that's how we push out all of our open grant opportunities. So as soon as it's live, you'll be the first to know if you're signed up for that list. We'll also have it on our website, but that's just the easiest way to get notified about that funding opportunity. And that's it.
Thanks very much, Sarah. Now to close, I think we're going to throw it over to Natalie from the Arizona Center for Disability Law. Natalie, I'm going to unmute you now.
Hello, everybody. We're almost to the end of our session 4. I hope this has been a very fruitful session. I want to thank Nicolette and Leah for being part of our call and answering questions and being very open on what's going on. Thank you so much. If you're still have questions, please go ahead and put it up on the chat. We will definitely try to get to as many questions as we can. We've got the living document through the Google. We will have a call next week, kind of to be determined in terms of what we'll be talking about, but we'll definitely let you know. I also would like to thank a couple of our elected officials, Nancy Bartow, who graciously joined us, Representative Bartow, Senator Bartow. If you would like to say a word or two, I don't know if you're still on. Oh, there you are.
Hi, can you hear me?
Yes, ma'am.
Okay, great. Let me see if I can get my video going. There we are. Thank you. Yeah, I'm sorry I had to jump on and off a couple of times here, but I tried to, stay a little bit in the know on what everything is, how all of you are doing and what questions are being asked and answered. So I'm here to learn as much as a lot of you are in terms of providers and what your clients are needing at this time, and how I can help spread the word. So I just appreciate being a part of what you're doing, and thank you for doing this weekly, because I think there's so many moving parts and so many questions on every level. It's really an advantage, I think, to be able to stay in touch. At least I'm learning a lot. So any way I can be helpful, or let me know. Certainly stay in touch with me if I can help any of your constituents, or do anything that might be helpful on my end. But you guys are doing a great job. Thank you.
At least one of your constituents is in the chat and saying, thanking you for being part of this call, Nancy. So
my pleasure.
Thank you, Representative Bartow. We really appreciate your time as well. And just as another side note, if you have any questions concerning any sort of legal questions, Arizona Center for Disability Law, who I represent, we're very busy right now. So please feel free to reach out to us. I will put my email on the chat in case you have any questions. And if you just have any general questions, you can also email me or Sarah Roof. And I think if there's nothing else to report for today, then I think we are done, and we'll definitely be in touch with you throughout the week and early next week for the next call. Thank you, everybody.